Hello, everyone. Thanks for joining us on the news briefing for this Wednesday. We're going to go ahead and get started with our COVID-19 information. We have Dr. Moreno with us from Public Health. Good afternoon, Dr. Moreno.
Good afternoon, Maya.
Do you have any information to share with us off the top, or are you ready for questions?
Oh, hi, Maya. Yeah, I'll just go ahead and take questions about COVID-19.
All right. So if anyone has questions for Dr. Moreno, go ahead and put them in chat, and we'll give people a couple of seconds to get the chat going. All right, here's your first question for today, Dr. Moreno. Omicron and its subvariants are more transmissible than earlier versions of COVID-19, and case test positivity and hospitalization numbers remain high for the past month. Is it time for masks to be required in public spaces again, such as transportation hubs, instead of just recommended?
Okay, thanks, Maya. So, thank you. Use of face coverings is one of several strategies that have been recommended to prevent and decrease the spread of COVID-19. So, but the main strategy that we have still is vaccination. So again, if anyone who's eligible for vaccine or boosters and has not been vaccinated or has not been boosted really should take advantage of the opportunity now to get vaccinated. Also, we have recommended as a department that individuals consider wearing a face covering if they're in public indoor settings. And that's really something that, in particular, people who are at greater risk of getting severe COVID-19 infections should consider, particularly those that are at risk of severe illness that could lead to hospitalization. So, so masking is another layer. And of course, the other strategies we continue to emphasize are stay home if you're sick. And if you think you have COVID, get tested to find out if you could potentially be infectious.
Thank you, Dr. Moreno. Next question for you. What is the messaging to those that test positive at home? Where do they go to report their positive case? How is the county keeping track of at-home positive tests?
So at this point, we continue to follow the surveillance that we have for quite some time. We primarily rely on reported positive and negative tests that come in primarily from laboratories or providers. And that really gives us more of a look for, allows us to look for trends. And again, trends are really what we're looking for. It's not so much the actual number of cases that we have, it's the changes in the rates that we're following and that the state is following. So we still are receiving reports of COVID-19. We're still reporting that on our website, and at this point, we do see that. The case rate has been more or less steady over the last few weeks, and then and COVID is still being transmitted in the community, and COVID is still leading to hospitalizations. So it's really important people get vaccinated and follow the recommended strategies to prevent from getting infected.
Thank you, Dr. Moreno. I have another COVID question and then a non-COVID question. I'm going to go ahead and finish up with our COVID questions first and then take the other subject questions. Dr. Moreno, now that children 6 months to 5 years of age are eligible for vaccination, how many in that age range in Monterey County have received the COVID-19 vaccine so far?
Maya, I have to go back to my team and see if we can provide a response to the person asking the question.
All right. Then there's a follow-up question to this. What would you say to parents who are not sure they should vaccinate their kids in that 6 month to 5 year age range? Sure.
So the FDA has authorized the use of COVID vaccine for children 6 months and older. The initial studies show that the serious adverse effects from the vaccine are pretty low. But if you have questions about whether or not to vaccinate your child who's 6 months to 4 years of age or 5 years of age, I recommend that they consult a healthcare provider.
Thank you, Dr. Moreno. Any other COVID questions for Dr. Moreno before I ask the non-COVID related question? Seeing none. Dr. Moreno, I have a question here related to monkeypox. Are you able to respond to?
Yeah, no, I'm just prepared to take questions on code, but be happy to take that question to Karen Smith and see if we can get a response.
Okay, we'll do that, and we'll follow up right after the briefing with the response we can get on that question. Any other questions for Dr. Moreno on COVID-19 for today? Seeing none, thank you very much, Dr. Moreno, for joining us and sharing information.
You're welcome.
Moving on to our next subject, we're going to talk about the 988 Lifeline Line. Beginning July 16th, 988 Suicide and Crisis Lifeline will become active. This is a national three-digit number, a nationwide three-digit number dedicated to suicide prevention and crisis support. Monterey County Behavioral Health and Suicide Prevention Services of the Central Coast are hosting a virtual community meeting on Wednesday, July 20th at 5:30 to introduce the community to this new lifeline and talk about why it is such a great addition of support to people. So we're very pleased to have our friend Dana Edgell from Behavioral Health and Andrea Toledo, I hope I've said that correctly, from Suicide Prevention Services of the Central Coast to tell us more about this. Good afternoon, ladies. Dana, there you go.
I apologize for that delay.
No problem.
We will be fine proceeding either way. Andrea is not with us at this exact moment, so we can either go to Hillary or I can go ahead and do the presentation. What would you prefer?
Hillary, how do you feel about that? Are you ready to jump in?
And I apologize. I just see my friend Andrea now, so whatever makes the most sense. We're ready.
So sorry.
Well, we're going to let Hillary's heart rate go back down and let you get started.
Okay. Well, thank you very much, Mia, for inviting us to be here together today. We're very excited to share with the community what is happening under 988. And this is a collaborative effort. Monterey County Behavioral Health, as you mentioned, is in partnership with Suicide Prevention Services of the Central Coast. And Andrea is here to speak in regards to some of the details in the rollout and what's happening. I'm also joined by Melanie Rhodes and Lindsay O'Leary from Monterey County Behavioral Health, because sometimes there's questions around how are folks getting connected to services in the community. I'm also joined by Carly Memoli, who works with Applied Crisis Training and Consulting. And together we've been working to focus on suicide prevention efforts. We've also been in collaboration with our Office of Emergency Services because they are a key partner when it comes to 988 and communicating with our community. So we do have a presentation prepared. So bear with me while I bring that up to the right point, and we will move through some slides with you all together today. So Andrea, let's see, these things that you always work better before we start. Is everybody able to see the screen, or are you seeing the preview?
We can see the screen.
Okay, great. So,
oh, well, we do see your notes on the side.
Okie dokie. We're just gonna flip this. There we go. Are we good now?
Good now.
Okay, thank you, Maya. All right. So Andrea, I will hand things over to you.
Oh, you're muted, Andrea.
Anyway, I just want to apologize for being a little late. We had some technical difficulties on our side. So everybody, my presenting partners can take a breath. So I do apologize for that. My name is Andrea Toledo. I'm the Director for Suicide Prevention Services of the Central Coast, and we're part of a larger organization called Family Services Agency. And we are, the folks are answering the phones when people call our lifelines. Currently, we have a local number, and then we have our national numbers. And as we move forward, we will continue with our local number. And then the national number that's the one that's moving into 988. So just very quickly, this is the work that we did last year answering the phones. As you can see, we provide services for Monterey, Santa Cruz, and San Benito counties. Just really quickly on this, the main point of this slide really is just to really point out that when people call our suicide prevention and crisis lines, 85% of those calls can be resolved on the phone, and that's going to continue to happen moving forward. So I think that's just in terms of looking at impact and the work that we do in terms of working with our responders, both paid and volunteer counselors, responders. They are highly trained to be able to work with people who are suicidal and in crisis. So we can go to the next slide. So moving forward, and actually what we're currently doing now is we are working very, very closely with Monterey Behavioral Health Services. We are working with Monterey County Emergency Services 911. Of course, we're working with MC Hopes, which they are bringing together community members and stakeholders around suicide prevention efforts. And we will continue to, work with our partners who are just been fantastic, in the past, and moving forward, we have a lot of really significant planning to do and are doing right now. So, next slide. So really 988, it's really basically just a super easy number for folks to remember, 988. And that nothing is really changing. It is really just a way so folks can have, higher access, more access. They remember that phone number as a number to call when they're in crisis or suicidal. We're not changing how we're working necessarily with our 911 partners right now. It is really just a starting point for how we as folks who are working within behavioral health services within that continuum of care we're currently working together, and then really looking at how do we move forward to be able to provide the people who are calling in crisis and are suicidal with the right response in the right way in the right time. So I think the main message here is nothing is really changing. It's just a really super easy to remember number. So that's where we are right now. Moving forward. So again, when people call the 988 number, we are Suicide Prevention Central Coast. We are the accredited crisis center for our area, for Tri-County. So when people call in and they have that area code, that Santa Cruz, San Benito, Santa Cruz counties, our local folks are picking up those phones. And then we are connecting them with, working with them on the phone. And if they do need help, or they're in need, if they're in risk, we do connect with our 911 partners. And then our 911 partners are the folks who make that decision in terms of what happens to that person at imminent risk. That's how that's our process, that's our protocol. And we're going to continue to work very closely with our partners around that. We call them a warm handoff for our 911 partners. Again, it is not 988 is not 911. 911, they dispatch, emergency services. We are picking up the lines and answering our phones, and again, partnering with our 911 folks when it's called for. And this is all starting Saturday. And actually, the 988 is available now, but it's we're doing a soft launch. Let's say nationally, it's going to happen on Saturday. So we are gearing up for it. We have lots of folks on the lines. We have retrained our responders. We have really been working very closely again with our community partners just to make sure we're prepared for what we believe is going to be a 30 to a 35% increase in calls coming into our lines. This is just a fairly easy schematic in terms of what happens when someone calls the Lifeline. There is a veteran line. There is a line with people for Spanish speakers. Again, someone calls into our lines. We pick them up. 85% of the time we resolve those calls. Again, if there's imminent risk or, we do a warm handoff and give as much information as we possibly can to our 911 partners so that they can respond, using the techniques and the mechanism systems that they have. That is us. What's the next slide? Again, just really quickly, we are one of 13 California crisis centers. And we're the folks who are answering those phones coming in locally to 988. If we are busy on the lines, then those calls get rolled over to one of our other California Crisis Center Lifeline partners. So if people call, it's always his answer. Somebody always picks up that line. All right, next slide. Again, this is really looking at, what the intent of 988 really is around. It's kind of a watershed moment, I believe, and I think people who work within this industry also believe, because it really it shines a light on mental illness, and it shines a light on being able to have communities work together to be able to provide a continuum of care over time. And so this is really the very beginning of what I feel is very exciting, and it's very significant in terms of how are we going to work with one another to be able to serve our community for folks who are in crisis. And there's a lot of folks who are in crisis. And so we are, again, this comes from the White House down to the states, down to locally. There's a commitment across the board to ensure that we're serving our communities. And again, the long-term vision is to, really look at what is it going to take to be able to serve folks who are in crisis, from, again, it's down the road, it's, 1, 3, 5 year longer planning, what does it look like? Will there be, additional beds? Will there be mobile crisis units? How will we, work together to make sure that we have a case management with folks along the way? So it's really, again, that's part of the long-term plan, but this is the start of something very exciting.
Thank you, Andrea. And I think Melanie is going to walk us through these next 2 slides on our current response.
Correct. Hi, thanks, Dana. So here currently in Monterey County, this is how it operates. So a person calls in to 988, 988 will triage their call. And as Andrea said, really work to resolve like 80% of the calls. If they need to do a warm handoff to 911, they'll do that. And currently our mobile crisis team, our behavioral health mobile crisis response, is dispatched out through 911 at the request of law enforcement to respond out. So that is currently how that workflow responds. Next slide. The vision is long-term, is building out that continuum of care and in keeping with best practice standards for sort of crisis response in this area. And so really looking at building out that ability for mobile crisis teams, like how they can be dispatched out, perhaps expanding that. Also looking at having more sort of crisis receiving facilities, as alternatives to hospital emergency departments, also having post-crisis wraparound. So there really is a whole continuum when we look at crisis care best practices. And so the long-term vision is to really continue to collaborate with all the partners and work towards that goal.
Thanks, Melanie. And so one of the important things is to get the message out into the community. And we're also very focused on our diverse communities in Monterey County. We will be hosting a bilingual webinar in English and Spanish next Wednesday. And we're hoping that our media friends can help us get the word out. As I said, it will be in English and Spanish, and presenting much of the same information as was shared with you today, just a little simpler version, because we want our community to know that help is out there and that it is a safe place to call. And we're also trying to help move away from some of the stigma around reaching out for help. And as Andrea and Melanie have discussed, this really is a great opportunity to normalize the fact that many of us need help from time to time, and having available supports 24 hours a day, 7 days a week in languages that our community members speak is very important. And so this is our first community event, and Monterey County Behavioral Health, again, working in partnership with our partners, will be available to come speak to community groups, providing information in English and Spanish at this point in time. So if there are members from our group meeting today or others that you know of, please let the community know that we are committed to getting accurate information out there. I did want to mention one other way to get involved with suicide prevention efforts is through the Monterey County Helping One Another Prevent and Eliminate Suicide, our coalition. All of this information can be found on our website, including the registration link for our upcoming meeting on Wednesday, the 27th, from 10 a.m. to 12 noon. And then we just really want to thank you for this opportunity to share this important information with our community, and for you to have contact information for myself and or Andrea. If you have any questions that we can't address today, we're happy to follow up with you. Stay in touch with us at our website. We have information on 988 in the community forum, as well as a wealth of other resources. And with that, that is our final presentation. Are there any questions that you'd like us to answer at this time?
Actually, I do have a question that is in chat now and a couple of others. Question for you. First of all, then the reporter is thanking you for this presentation. Is there any sense that now that the number is easier to remember, there will be an increase in calls from people in crisis?
We would say yes. And Andrea, would you like to respond to that?
Yes, so we're expecting a 30 to a 35% increase in the calls coming into our lines. And, you know, we do already serve people in crisis. I mean, when people call suicide prevention line, they're in crisis. And we do assess folks in terms of, you know, being suicidal or they're really working through other crisis modalities. And so, because it's an easier number, we will get more phone calls, and it's going to be interesting actually to see what kind of calls we're getting and if they're different. So that's something that all of us across the country will be learning. You know, about, you know, will the calls be different?
Thank you. And I have another question about the community webinar that's coming up on the 20th. Is the webinar itself bilingual, or is interpretation available? Just to answer this question.
So I guess to be clear, the information that will be presented on the slides is English and Spanish, and then there will be a simultaneous interpretation provided. So the participants who would like to hear the information will be listening in the Spanish channel, receiving that information in Spanish, and it will be interpreted from the English presenter. Does that answer the question?
Yes.
Okay.
Yes.
Just
And then,
one, I'm so
go
sorry,
ahead.
just one point of clarification on that. I saw the question referenced the webinar being on September 20th. It's actually going to be on July 20th. So it'll be next week, next Wednesday.
Thank you.
Yeah.
Thank you. I hope that wasn't me.
Oh.
Another question for you. The reporter had asked a question about 911 being easier to remember. Can you also stress the importance of having this number now that it is easier to remember for people and appreciate the response? The importance of having this number, having a number that can be promoted, that is easy to remember. How important is this for the big picture?
I think in some ways, just as you're phrasing that question, it really hits on why, right? We need to have an easy to remember number that that folks, you know, on our slides, I'll be honest, Carly was pointing out we had 800 listed in one of the numbers when it should have been 877. And so just such a great example of why we need to simplify, streamline, and help and have easy ways to communicate how to get connected to the Lifeline. So yes, we think it's a very critical time as many of us in the communities are struggling with mental health related issues, emotional distress. We know we've come out of a very difficult period, and a lot of people are still experiencing a lot of stressors and crises in their lives. So we are very excited to have a easy to remember, easy to communicate number to connect folks to help and care.
Andrea, I think you might have mentioned, or Dan, you might have mentioned the stigma, really normalizing the fact that people are in crisis and that, you know, everybody needs some place where they might be able to go and get help. What about a person who may feel, I don't know what kind of crisis that I have, you know, maybe I'm not sure if I should be calling this number or not. How would you handle someone who, you know, I think, Andrea, you described it as crisis modalities. You know, you could get anybody on the other end of the line.
Mm-hmm. I think that's part of how we train our responders in terms of really listening and really connecting with those callers. First, assessing, first of all, risk. And that's really, for us, is most significant in making sure that people are safe. For folks who are, should I call? I'm not sure who to call. We have a very robust and deep resource list that our responders have access to. So if we're in talking with the caller, we can offer these kind of resources. These are these phone numbers that you can call. And so really kind of making those connections with the appropriate support service, and really being that conduit sometimes.
Thank you. And then one more question. I noticed in your slide, you mentioned 80% of calls that come into Crisis Line are resolved on the phone. Is that a good number?
Yes.
Would you like to see that improve?
Of course, we always would. I mean, some of those are people hang up, so those, include some hang up calls. Some of those also include, again, referring over to 911 services. We do get some abusive callers who call in, so we're really looking at, kind of, slicing and dicing those numbers. But we would love to, like with anything, we'd like to improve. But I think those are pretty significant and very positive numbers.
And then one more question for you. How many people are staffed at the local call centers to be able to respond?
So currently, we just hired staff responders for the first time in the history of our lines. And so currently we have 12 staff responders, and we have about 85 volunteer responders on our phones right now. And so, particularly gearing up for, this Saturday, yikes, we have several folks on the lines at a time right now, because we do expect a large increase in the calls coming in. So we're really excited with our staff responders. We haven't had them before, but it's, and our volunteer responders are ready to answer calls.
And I wanted to jump back in, and I do apologize. I wanted to emphasize the correct date for the community forum. It is next Wednesday, in July 20th. Thank you, Carly. And I just wanted to pop this slide back one more time. And Maya, I will send you the flyers for this event, and if we could share those, that would be great.
We absolutely will. Is any registration needed for people to join?
No.
They can just join in?
Just join right in, yes.
Thank you. And one more question for you on the call center. Is the 95 or so responders at the call center enough? Are you still recruiting?
Yes, we are always recruiting. We do have, of course, for our staff responders, but also for volunteer responders. And we just ended a class right now. We have a 10-week class for our volunteer responders. We'll be starting another one in September. And then for our staff responders, we're actually doing a very condensed 2-week training, about 40-hour week trainings for 2 weeks plus some onboarding. So we are always looking for more staff and volunteers. And so my contact information is part of that our slideshow. But again, we're always looking for folks.
Thank you both very much for really walking us through the importance of 988. What a great step forward for everyone, not only in Monterey County, but around the nation, who can more easily get the help that they may need at that moment that they need it.
Thank you for this opportunity. We really appreciate it.
Yeah, thank you so much to everyone.
And now we're going to come back to Hillary, who almost had a moment there before our previous presentation. Hillary Thayer is our library director, and she's going to tell us about the library's launching a new service called Digital Navigators. And it's really a great how-to for basic skills. So Hillary, tell us all about it.
Sure thing. Thank you for inviting me today. And I've put up the website, that is connectedca.org, and I will also paste it into the chat. This website is fully bilingual, English and Spanish, and every service provided here is fully bilingual, English and Spanish. So you can see with one click, you can get a Spanish version of the website, and my computer offering to translate it for me. But don't worry about that because it's already translated. This is a new statewide service that we're just promoting through your public libraries. And the intent is to connect people to devices, home internet, their own hotspot, or basic digital skills to enable them to really get across the digital divide and participate in all the resources that are out there. What studies have shown, and the reason this was started in California, is that for all the services that are available, like subsidized or free home internet, a free Chromebook, or a free hotspot, far fewer people are taking advantage of them than actually qualify. So this service is completely free to both the client, they call them clients, and to the libraries. The client can connect with them by calling and leaving a voicemail, sending a text, sending an email, or using a digital form. They just leave contact information and contact preferences and their question. And then a navigator does the research and gets back to them in their preferred method. So the digital navigators are separate staff that are devoted to this purpose. They research the person's question and get the best answers, then work with the client to help them through the process. So for example, if somebody needs subsidized home internet, they need internet to their home, they cannot afford the basic call your provider, then the person will do research, will guide them to different programs, and help them through the process of application or qualifying. So that may involve teaching them how to fill out an online form, how to scan and upload a document that's proof of income, or anything else. Sometimes these are resolved with one phone call, sometimes several, and a lot of research. The advantage to doing this versus coming into the library is these folks are specialists and they will take the amount of time it takes with the client to focus on their needs. This is different than maybe coming into the library and encountering one of our staff who then has to go off and do 5 other things or may not be the expert in the area. It is fully bilingual, including the Navigators, Spanish and English. It is completely free. So I'm ready to answer any questions anybody may have. And I just would like you to get the word out, get that call us or text us or email us word out. And if you would like a flyer or a social media graphic, you can reach out to me. I'd be happy to send them your way.
Hillary, this is a fantastic service. It's almost like having your own tech support, right at your fingertips. Let me ask you, I look at this graphic and I see people of all ages and all variety of needs. Who's the target for digital navigators? It seems like it's really everyone.
It's really everyone who needs the first lift over the divide. It's, for example, the digital navigators may help somebody learn what are the basic parts of a computer? How do I connect my laptop to an open Wi-Fi source? They're not going to teach Microsoft Office to somebody. So they're helped with that basic lift. And really what is missing for a lot of people is just the process. They may see a flyer with a phone number. You can qualify for this. But then if the qualification is fill out a web form, scan and upload a document, have all this stuff at your fingertips, and you need to know how to use a computer to do that, then the person may get stuck and walk away. And so they're really there to lift them over that initial gap and get them on the road to their next resource. And their next resource may be a local class, coming back to the library and taking one of our online classes, or a local senior center or job center that can get them that next step down the road.
Is this an kind of an outgrowth of the fact that there are more services now being offered to people online, but the flip side of that is that there may be people who just don't know how to get to it. They see the service that they want, but they may have a device that doesn't work for what they're trying to get. It's kind of like growing pains for available services.
It is. It's both the outgrowth in the services being offered online and how do we keep people connected if they cannot go visit the place they used to visit? So many of us were closed during the pandemic where you would have walked in and had a person help you or sat down in a public computer lab. So people sometimes got devices, but now need that extra oomph. How do I use it? Or they may have, for example, I was working with somebody who has an iPad and knows how to send and receive email and look at pictures, but then wanted to enroll in an online class on her iPad. So the digital navigators can help them learn to use their iPad. Somebody who maybe, I'll give you an example. We lend hotspots from the library. We check them out for 3 weeks. They're completely free. There is a huge long waiting list. So a person in urgent need of a hotspot, we are not going to be that answer. Or we may be, as I talk to our staff, I say, that may be the patch when the person needs a tire. They need home internet or their own hotspot. We're the patch that can get them to the mechanic. Let's get them a tire. Let's put a tire on their car. Let's get them home internet. So it's to get that oomph. And it's for any age, any income situation, any skill level. This person could start with a phone call. They can have no skills and no connectivity and start by calling that 800 number and get started. So there's already no expectation of skills to even start using this free service.
So for people who are really looking for that how-to, they can call the number, they can text the number, they can email to this Connected California, but the library is still a safety net for people if they want to come and talk to somebody that's local, somebody that they know, their neighborhood branch, and they have questions.
Absolutely. We can help them decide if this answer is the best answer for their need. If we have something in-house that we can get to them or show them how to use. And the digital navigators will sometimes refer back to us because they'll look at where is the person from, and the person may need, for example, if they would like to apply for a job, they may need a database like our Job Now for resume review. The person may need to scan and print documents. They're going to refer right back to their local library and they may do the work to connect with us, help them apply for a library card, help them figure out when they can come into a branch to print their documents that they need. So we work in partnership with the digital navigators to get them to the best place they can to meet their needs.
Well, this is fantastic. Thanks very much for sharing with us about how this works and how accessible it is. While I have you, I just can't resist asking you about the summer reading program. Is it about wrapped up? Because we're seeing a lot of fun photos on social media about your activities.
Our summer reading program is going gangbusters. We are having such a great summer. People really did want to come back to in-person programs. And we're holding most of them outside, which is a new experience for us. Our enrollment is up. It's through the roof. Even pre-pandemic, our enrollment is much higher. We'll wrap up toward the end of July, but for both summer reading program and lunch at the library. And I just want to let you know in terms of lunch at the library, your Monterey County Free Libraries have handed out over 11,000 meals to kids and over 8,500 activity bags. That's not even the activities in the library. That's things people are picking up and taking right home. And we're having a great summer, and we're really proud and happy to talk about it. Thank you for asking.
Well, I saw a lot of young readers with little llama toys wandering outside the libraries, and they just loved them. So you hit the nail on the head all the way around, even with the goodies that they get for their reading logs.
Yes, they're enjoying their prizes and enjoying their time at their libraries.
Thank you, Hillary, and thanks everyone for joining us on the news briefing today. We really appreciate your attending. Our next briefing is next week, and we'll see you then. Bye, everyone.